Good day, everyone. My name is Chantal Edwards. I'm a fourth year dental student, and today I'll be doing my literature review on an article surrounding the topic of sedation. Our objectives for today are as follows. I'll be describing the article that was assigned. We'll be doing an identification of the major topic. We'll be assessing the type of article used, identifying its purpose, providing a summary of its key points, as well as determining the quality of the article that was used. Firstly, the title of the article was Review of Monitors and Monitoring During Sedation with Emphasis on Clinical Applications. It was authored by a dentist, Stephen Wilson, who also serves as the director of the School of Dentistry at the University of Colorado. The journal that it was published in was the Pediatric Dentistry Journal. The abbreviation is listed on the screen, and it was published in the year 1995, volume 17, issue number 7, through pages 413 to 417. And to the right of the screen, we have an image of the author himself. Another important thing that would come under the description of the article is the journal impact factor. The impact factor of a journal is commonly used to evaluate its importance. So, to calculate it, the number of times a selected article is cited within the last few years determines the journal impact factor. And for the journal that was used, which was Pediatric Dentistry, an impact factor of 65 was found. And in comparison to other articles, other journals rather, and just by rule of thumb of a number being greater than 10, an impact factor of 65 suggests that the journal Pediatric Dentistry, as well as the article, has been cited many times and is deemed relevant and important to its users. The major topic of the presentation, as was indicated by the title slide, is sedation. So going forward, we'll be seeing a lot of terms and jargon related to sedation, but for a better definition and understanding of what sedation is, let us look at some ideas surrounding it. So the first thing that comes to mind is an image of relaxation, sleep, no fear, anything that requires you to be in a more relaxed or a depressed conscious state is what comes to mind when we think of the word sedation. Formally, it is defined as the depression of a patient's awareness to the environment and a reduction of his or her responsiveness to external stimulation. And this stimulation could take the form of sound, taste, pressure, any sight stimuli. Whatever reduces the response to such stimuli is referred to as a state of sedation. And it follows a continuum. So a patient could be minimally sedated, moderately sedated, deeply sedated, or under general anesthesia. Minimal sedation is something we'll be a little bit more familiar with in dentistry, where a patient is prescribed an oral anxiolytic, for example, to help with their fear or nervousness about a procedure or just a general visit to the dentist. Moderate sedation involves the use of a sedative that is more powerful than what is used in minimal sedation. However, the patient is able to respond willingly to any external stimulation. So they're in a state of what is referred to as conscious sedation. Deep sedation involves a process where a patient is depressed in terms of his awareness, but he's still able to control his cardiovascular function independently. However, in this state, you're not able to independently or spontaneously ventilate. And so these are things that are usually done with the use of some devices or monitoring systems. And finally, under general anesthesia, a patient who is sedated in this way has given up spontaneous ventilation, airway reflexes, as well as independent cardiovascular function, and these are all taken over by substitutive devices. So now that we understand what sedation is, let us jump right into what our article was about. Now, the article type, I deemed it to be expert opinion because as if we go back to the title, which is a review of monitors and monitoring during sedation with emphasis on clinical applications, we see that the author's purpose is really to provide a review of knowledge that already exists. And so, using the evidence pyramid, we will categorize it as being background information or expert opinion, falling into the realm of unfiltered information as opposed to an apex of the evidence pyramid with filtered information. Some features of expert opinion articles are as follows. The article usually provides information summarized from other experts. So even though the article itself is not a part of this presentation in terms of what is published in the journal, it lists roughly 15 sources, and these are all from other experts in the field of monitoring systems and sedation. And all of that information has been summarized by Dr. Wilson and presented as such in the form of a review. The information is unfiltered, and because of that, it takes a longer time for publication, which is usually 2 to 3 years, as opposed to a study at a higher level of the evidence pyramid, such as a systematic review, for example, which will have a shorter review period for publication in a journal. It includes information in other publications and published textbooks. So a lot of the works that he summarized were actually from articles published in other journals outside of pediatric dentistry and also textbooks. But nonetheless, it provides a convenient summary, so it is able to pull relevant details and what is relevant to the reader from 14 or 15 sources into one combined review article. So what exactly is the purpose of the article? What was Dr. Wilson's intended effect? Based on what I saw, I deemed it to be a review of current monitoring devices utilized in sedation in a clinical setting. As a dentist, he wanted to focus on the impact of monitoring devices in the dental setting, but notwithstanding, he realized that this is something that is used clinically and broadly. And so the review covers not just a dental space, but a medical and dental space in general. Its purpose is also to inform, and it does this as it reviews existing information by other experts to determine the pros and cons of each monitor. And that is something we'll get into as we discuss the key points of what the article mentioned. So let's jump right to it. The main points that he discussed were a review of each of the 4 listed monitoring systems, which were a pulse oximetry, blood pressure cuffs, capnography, a precordial stethoscope, as well as guidance, monitoring, and compliance in using these devices in a clinical setting. Pulse oximetry, and to familiarize ourselves, I have an image to the right of the screen, is considered as the gold standard when measuring or monitoring rather the vital signs of a patient who has undergone sedation. It measures continuously the degree of oxygen saturation of the patient, and it is highly advantageous in that it is non-invasive. Now, how it works specifically is that it has a sensor that has 2 elements, one that emits light in red and infrared wavelengths, and the other element detects light transmitted through tissue. Oxygenated hemoglobin is able to absorb more red wavelengths of light, while deoxygenated hemoglobin absorbs proportionately more infrared. And these readings are transferred to the monitor that we can see, and that is able to inform the practitioner or whoever is observing the patient's vital signs as to the degree of oxygen saturation of the patient's blood. Again, it was mentioned that it's advantageous in that it's non-invasive, and it is also safe, simple to use, provides information rapidly. Notwithstanding, it has the disadvantage of having non-reusable probes. The fingers can be dislodged if the patient is not compliant prior to, to sedation, and in some cases, the emitted light source can cause a burning. So these are some things that came out when Dr. Wilson reviewed this system. Another very important monitoring system that was used were blood pressure cuffs. And this is something also that we're very familiar with. So we have a sphygmomanometer to the right of the screen as well, a digital one. It is also safe, non-invasive, and easy to use, which gives it quite the advantage. It is something we've been familiar with in the medical sphere for decades. And in the case of an automated blood pressure machine, it indirectly indicates the systolic and diastolic blood pressures, as well as tells the heart rate at discrete intervals. So again, it's advantageous in that it is simple to use. Determination time in terms of using an automated machine is quite rapid. And again, being non-invasive, it is much preferable to use on the patient. How it works exactly is that the bladder, not shown on the screen, is inflated over a few seconds to a pressure that basically blocks or occludes the blood flow in the brachial artery that is being measured there. It is then deflated in small steps, and during these steps, a transducer monitors any oscillatory signals. When there's a first major increase in an oscillatory signal, it is recorded on the monitor as the systolic reading, and this deflation is continued throughout, and when there's no further change in oscillatory signals, a diastolic pressure reading is given. So as was said before, quite useful, quite advantageous, but notwithstanding, in a patient who, for example, has not received sedation, he or she might be non-compliant. It might cause a little bit of pain at first and discomfort, especially when it starts to occlude the artery. And in general, in a provoked and non-resting child or patient, it might be difficult to get an accurate reading, as these actions, such as being unruly and non-compliant, might spike the reading. Another monitoring system that he focused on was the use of a capnograph. To be fair, capnography represents one of the least understood and utilized monitoring devices in dentistry specifically, but nonetheless it is important because it is used to determine airway patency. And there are very few devices that are able to do this, hence its popularity. It measures expired carbon dioxide, and again, it has the advantage of being safe. However, it is slightly invasive for the patient. How it works is that it has a unit within a chamber within the capnograph that is supplied with sucked air from the patient. So a tube is placed in the patient's nose, which makes it a little uncomfortable, and that sucks air and supplies it to the chamber within the capnogram, where the volume of carbon dioxide in that sucked air is compared to a similar standardized volume within the machine, and that determines if the person is in a state of excess carbon dioxide, normal carbon dioxide, or too little carbon dioxide for the volume of compared air. And that basically measures how patent the airway is, how reliable gas exchange is during a state of sedation. And finally, we have the precordial stethoscope, not displayed in the image to the right. That is an arrow, but we're familiar with how a stethoscope looks and the accompanying bell attached, which is something that has been available for decades in the medical sphere. and is used to obtain heart, respiratory, GI, and joint sounds as well as determining cardiovascular anomalies. It too has the advantage of being quite advantageous in being easy to use, safe, non-invasive, and to optimize its use for airway and heart sounds, we have to depend on how well we place it on the chest wall. Now to do that, we create an imaginary triangle on the patient. The base of the triangle is the line between the patient's nipples, and the apex is formed by the remaining sides joining the nipple to the precordial notch, just at the junction of the neck and the chest. So the patient should be reclined if they're going to be sedated, and then you'd place the stethoscope bell at the precordial notch, and their breathing sounds will be loud and dominant, whereas the heart sounds will be faint. Now, if you move the bell along that imaginary line between the precordial notch and the left nipple, the breathing sounds become faint and the heart sounds dominate. So using that triangle as a landmark and following those steps oscillating between the precordial notch and the heart is and the nipple rather is able to provide the practitioner with heart sounds as well as airway sounds. And again, this is an effective way of determining and monitoring during sedation. Most important to note is that Dr. Wilson pointed out that, to his knowledge, there has never been a study determining the degree of compliance of dental practitioners in the use of procedures, monitors, and classification of depths of sedation in published guidelines. It is not known, therefore, how well these devices and their guidelines for use are adhered to, irrespective of the pros and cons of the monitoring devices themselves. So he has provided all the information that we need to know in terms of the advantages and disadvantages. But at the time of publication, there was no study regarding dental practitioners' use of these devices, as well as adherence to the guidelines and classifications of sedations that are published. So a review concludes that compliance and monitoring of dental practitioners themselves was something that was lacking. Finally, I assessed the article by utilizing our evidence pyramid. Right, so as was aforementioned, the article is one of expert opinion, Dr. Wilson being an expert in the field of dentistry, but notwithstanding, because there is no filtering of the information, such as an evidence-based process, no systematic review, it's not critically appraised by individuals or as a synthesis, nor were any trials, studies, or control or reports done. And because of that, the article has been found to be woefully lacking in terms of believability. So in assessing the article, I utilized these three prongs: validity, reliability, and credibility. Validity itself refers to the degree to which a measuring tool is able to capture the accurate data, and it can be external or internal. Internal refers to its accuracy in capturing the data, and external refers to its transferability, meaning how well can the information I've captured be applied to a general population. Reliability refers to how well the measured data or the experiment can be done and the same or similar results are captured each time the same steps are followed for the experiment. And credibility refers to the degree to which the article, the results of the experiment can be believed. So using validity, reliability, and credibility, these were the conclusions of the article done. I deemed the article to not be valid because, like I said before, it was not experimental in nature. There was no study design listed. It was merely a review of the works of other persons done. And because of that, you cannot apply it to everyone because you did not He did not assess a specific group of people. He only reviewed monitoring systems in and of themselves and just added information what he as an expert believed to be true about them. So even by his own admission, saying that there weren't any studies amongst dental practitioners' use of these devices to determine efficacy and following of guidelines, there was nothing to conclude that the article in and of itself was valid. It was credible, yes, because it was done by an expert, someone who is renowned in the field of dentistry as stated by his position and education. And the referencing of the article using his 14, 15 sources suggests that he did his research in coming up with the conclusions that he made. Notwithstanding, though, the article cannot be deemed to be reliable because there was nothing to compare it to. So if someone were to do a dive for information as well and come up with information that differs from what Dr. Wilson's conclusions were, then we would be in a conundrum as to who to believe because an experiment was not done to determine how accurate and how reproducible his conclusions were. So again, the article was not valid, it was credible, but not reliable in my estimation. And that concludes my assessment of the article as well as my presentation and literature review of the article. If there are any questions for this presentation, they can be forwarded to the email address below. And I thank you for listening.